This is EN Radio. Nigeria's first Muslim radio.
Assalamu alaikum, good evening, and welcome to EN Radio. I present to you the health advocacy on the show. Myself, Mohammed Saeed, and of course, I'm not alone. I have with me right here.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Zainab Adirom, and it's nice to be back on the show.
It's very lovely to have you, Zainab. And also, of course, we're not alone. We also have our expert host, the Dr. Hadiza Marliyya Suleiman. Doctor, how are you doing today?
Assalamu alaikum. I'm very well, thank you. How are you today?
I am doing fantastic. And also, Dr. Muhammad Habib also on the show. Assalamu alaikum, Doctor.
Alaikum salam wa barakatuh.
It's good to have you back on the show again. And of course, moving on, we're going to take a very short break and then we'll be back and then we'll dive into the topic of today. Don't go anywhere, stay.
This is EN Radio. Nigeria's first Muslim radio.
It's still your favorite radio channel, EN Radio. And this evening we're having the health advocacy. I have two fantastic doctors with me here, Dr. Hadiza Marliyya, and I also have Dr. Habibu. This evening, I'm going to start with Dr. Hadiza. Doctor, kindly walk us through the meaning of burn injuries.
Burn injuries are injuries that occur as a result of various agents. Generally speaking, according to the World Health Organization, WHO, burns is a form of death of the skin. Sometimes not just the skin, into some deeper tissues beneath the skin. So, are aware that burns can occur as a result of a variety of things. It can occur as a result of dry heat, for example, flame burns. It can occur as a result of wet heat, that is called burn injury. It can also occur as a result of electricity burns. Other things that can cause burns include chemicals, which may be alkalis or acids. And we also know that irradiation can cause burns. Burn injuries can also occur as a result of friction injuries. That is when the skin is rubbed against a hard surface. For example, in road traffic crashes, when the skin is dragged against the coal tar, a person's skin, may have burn injuries. So I hope that everyone understands burn injuries now after defining this.
Of course, absolutely.
What's the first thing a person should do when they get a burn injury?
Well, I was planning on discussing that on another episode because burn injuries are actually, it's a very wide topic. The topic today is, what are burn injuries? So I wanted people to just be clear on the definition and then the agents that cause burn injuries, as well as, the burden worldwide in West Africa and then in Nigeria as well. And, to answer part of your question anyway, burn injuries can occur, as I mentioned before, as a result of a variety of agents. So the way that the burn injury will be managed will depend on the type of burn injury the person has. The commonest type of burn injuries we sustain are mostly scald burn injuries at home. I'm sure many of us have had a toddler, a child, burning him or herself with hot water, probably spilling a cup of hot tea, or while crawling in the kitchen, dipping their hands in maybe a bowl of water left carelessly on the floor.
Let me cut in there.
Yes.
Now, from at that point, this is what happens a lot most of the time. Maybe a toddler touching the pressing iron, or a hot water, or burns from the kitchen, and etc. So these minor injuries like hot water burns, what are the first aid measures that we should have in the house to take care of this? That is number one. Number two, which skin cells is affected when there is a...
Yes, thank you for asking that question. So the first thing that one should do when anyone is burnt in the form of a skull burn injury is not to apply any form of grease, not to apply any form of palm oil. Many of us do that. Not to apply any form of coal tar. Some people apply that on their skin. But to actually immerse, or should I say, place that part of the body under running tap water, that is tepid water. You leave that part of the limb under that running tap water for about 15 to 20 minutes. Now, the reason why we do this is to allow for the heat to dissipate, to dissipate from the body so that the heat that is required to cause that burn injury will be less. And thus, even if there will be some form of damage to the skin, it will not be as bad as if one hadn't placed that part of the body under that tepid water. So after doing that, before I move on to the next thing, do not immerse the limb in gutter water, please. Some people would say that if you place it in mud water, or gutter water, that is medicinal for that part of the body. No, it is not, because anything that contains germs, that is dirty, will further worsen that scald injury. So after running that part of the body under the tepid water, you dab that skin with a clean towel or clean cloth, and then you can apply something bland at home. If you have Vaseline, if you have, olive oil, if you have shea butter, those are all bland agents, and you can just apply a thin layer over that area. You can also apply, if you have cling film, clean cling film, the cling film that's used to wrap certain foods in the kitchen.
Yes,
you could use that. And cover that. And then you can now, transport the person to the hospital for expert care.
The second question I asked, which skin cells is affected?
Yes. So as I mentioned before in the definition, burn injury is a form of a death to the skin. So a form of death to the skin and the underlying tissues. So actually, you may have all layers of the skin being affected by the burn injury. It depends on a lot of factors. It depends on the agent that is responsible for the burn injury. It depends on the time in which that agent was in contact with that skin. So you can just have the epidermis affected. You can have the dermis affected. You can even have the fat affected, which is known in medical terminology as the subcutaneous tissue. You can also have the thin layer that's covering the muscle called fascia affected. And from then on, it can even go deeper. It can even go as deep as the bones. And that is, quite severe and is called a major burn injury.
Question is, let's say some people recommend collagen supplements whenever you have burns or rashes. How true is that?
Collagen supplements. Whenever a person has an acute burn or an acute rash, generally
both.
Oh, this is the first time I'm hearing of that. But generally, collagen supplements.
So that's why I'm asking. Yeah.
Oh, okay. So collagen supplements, I know they're used in a variety of disorders. A lot of people that have arthritis take collagen supplements because they believe it helps to regenerate their joints. But clinically, really, there may be some benefit, but clinically, it's not really been shown to have, a definite clinical effect or improvement on the burn injury, really. That has not been proven. We take a lot of things sometimes just because we've heard about it being useful, or because somebody has taken it, or somebody is taking it, or a family friend or a relation is recommending it, but it doesn't mean that, it works.
Okay, but Dr. Hadiza, what exactly are collagen supplements? Because I really don't understand.
Yeah, well, collagen is actually, should I say it's a complex that is found. it's found in skin and in, deeper parts of the skin. So it's contained in skin. And, collagen is, it's responsible for regenerating damaged skin. You understand? We have
Okay.
immature collagen, and then we have mature collagen. So, for example, when your skin is damaged, either maybe by trauma, you fell down, you had an abrasion, or you had a burn injury, or any form of physical trauma to your skin, the skin will try and regenerate itself by making sure that that immature collagen is going to become mature collagen. So I guess the reason why some people take collagen supplements is, they probably think, okay, fine, since collagen is, if collagen is helping me regenerate my skin, if I take it externally, that might help me further. But really, clinically, taking collagen externally in the form of supplements hasn't been found to have any beneficial effect. The skin will help itself once a person is healthy enough, and the work will be done. You don't need to take any supplements.
All right. Thank you very much, Dr. Hadiza. This very quick, short break. And when we return, we're going to discuss how untreated burn injuries can actually lead to cancer. Please don't go anywhere. Stay with us.
This is EN Radio. Nigeria's first Muslim radio.
Welcome back again. It's still your show, Health Advocacy. And with me on the show is Dr. Hadiza and Dr. Habibu talking on the show. Without wasting much time, we're going straight into how untreated burn injury can lead to cancer. And I believe that Dr. Habibu can relate with that. Dr. Habibu, how do you relate burn injury leading to cancer?
It's like, just like Dr. Hadiza just said, burns, depending on the degree, a very deep burn and is wide, that covers a large area, it may take a long time to heal. And any injury, any wound that takes a long time to heal, such we call chronic wound, may result into cancer of the skin. It could even heal after some time, maybe it's healed over 6 months, but it could come back in 5-10 years that the wound will recur. When the wound recur, most often than not, if you take a sample of that wound, you'll see that it's now cancer, a type of cancer we call squamous cell cancer. The ulcer that comes back is called Marjolin's ulcer, which is an ulcer that comes from an old scar. And most of the time, these ulcers, they turn out to be cancer of the skin, because it resulted from an initial chronic wound. I hope I'm able to answer that question.
Yes, you have. Zainab, you were saying something?
Yeah, I was just wondering what could cause an injury that has healed to come back and then become cancer. That seems really almost unbelievable to me.
Yeah, well, Dr. Habibu, how believable is that?
Yes, that happened. It's called Marjolin's ulcer. What happened is that for a chronic ulcer, that means that there is chronic irritation.
Okay.
And because of the chronic irritation, there can be what we call mutation. Mutation is change in gene. If there is change in gene of one single cell, it will not be noticed. However, as this abnormal cell continue to proliferate or continue to reproduce, it starts forming abnormal cells, and the growth of this abnormal cell is geometrical. That's over time, they continue to multiply and multiply. 1 becomes 2, 2 becomes 4, 4 becomes 8, 8 becomes 16, like that. It continues to multiply at a geometrical rate. Then it gets to an extent where these cells are enough to be seen. Because they are abnormal cells, they turn out as wound because they don't have the normal function of the cells of the skin. So they can't perform that function. They are not tensile. They are not covering the skin. They are just there, like immature cells. So it turns out to be wound. So it may take a long time before a single mutation can produce a result that can be seen. So a microscopic defect before it becomes macroscopic, which is microscopic, the one you can't see with the eye, because before it becomes macroscopic, it will take a long time for multiplication of those abnormal cells, which may be 10 years, 15 years, 20 years before we can now start seeing it. And the abnormal cells are usually cancerous cells, because cancer, the definition of cancer is abnormal cells that continue to multiply even when the factors that initiated the abnormality has been removed. And they have the ability to eat or invade the surrounding cells, and they can also travel to distant sites. And cancer cells, because they are abnormal cells, they can't function like normal cells. Instead, they cause havoc anywhere they are because they invade whatever organ they find themselves in. So cancer of the skin, one of the factors that causes cancer of the skin is chronic ulcer. Like the doctor already said, radiation, exposure to radiation is also a common cause, and use of chemicals like bleach and other chemicals you want to find in the factory. If you expose the skin to chronic irritation, then there can be cancer. Even infection of the different part of the body, skin is different part, that's the connective tissue, or rather the epithelium of the skin. Any chronic infection can result in cancer at time.
Building on that, sir, there are these two words that are used interchangeably, rather ignorantly or not, the word cancer and tumor. The question now is this: is it proliferation of cancerous cells result into development of a tumor? And in fact, is there any such thing called non-cancerous tumor?
Oh, yes. Basically, when we say a tumor, we mean a growth. So a tumor just means growth. It's an umbrella word. So you can then define the growth into either a benign tumor or a cancerous tumor. So a benign tumor is a tumor that is not cancerous, which means it cannot invade the surrounding and it cannot spread to distant sites. Whereas a cancerous tumor is a tumor that can invade the surrounding and then can travel to other parts of the body. So tumor is an umbrella word, which can refer to a benign tumor or a malignant tumor. Malignancy is another name for cancer. So we can say it's malignant tumor, we can say it's cancerous tumor. I hope I answered that.
Absolutely, you've done that perfectly well. Dr. Hadiza, back to you. Do you have any take on Dr. Habibu's submission?
Yes, thank you, Dr. Habib, for your input. So I would like to share some of our experiences. Shall I say some of my experiences to get together with my colleagues on?
Go ahead, please.
On burn injuries that present with cancerous lesions. So commonly, the way they present, what usually happens is for deeper burns, that is for full thickness burn injuries, which sometimes extend beyond the fatty tissue, even up to muscular tissue. Many times we don't manage them properly. Many of our people are fond of going to traditional healers who apply all sorts of concoctions onto those burn injuries. Now, this results in, maybe an initial healing, partly of that wound, but subsequently, it gets infected because what they applied over that area is actually, contained, it's not, free of germs. And therefore, they end up having infections, and then the wound breaks down. And because it's a wound that should have been managed in a specialist center, in a specialist burn center, the wound never really heals as it should. because these wounds, many times, more often than not, require some complex surgical procedures. And so the person ends up having, a long-standing wound. It will heal, it will break down, it will heal, it will break down. And then there's still some other interventions ongoing, which are still non-medical. And so these patients present after like about 10 to 20 years in our center with these cancerous lesions, unfortunately. So I just wanted to, share my experiences.
Okay, thank you very much. On burns, some medical scientists, they regard cold burns or frostbite as a type of burn. Do you regard it as a type of burn, frostbite? And if you do, like the friction where you open a tap water rushing down on the affected areas, what do you do to a frostbite when a frostbite is imminent?
Well, frostbite actually, it's a separate clinical entity on its own. I know that a lot of people may have come across it on the internet or in some texts that frostbite is a form of burn injury because, yes, there is some form of damage to the skin. And of course, if it lasts long enough, it can damage even the underlying parts of the skin. However, burn injury, is generally is classified separately from frostbite because the pathological changes which occur in frostbite are slightly a bit different from the pathological changes that occur in, burn injuries that occur as a result of thermal burns, which are dry or wet heat, irradiation, friction, chemical agents, and, what I mentioned, earlier. And if we want to talk about frostbite, it's going to take us the whole day, really, because its own management is slightly different from the way we manage burn injuries.
All right. Thank you very much. So at this point, we will be taking questions from our audience, and we're trying to work on the network line here. Before we go on a quick break, I'd like to ask Dr. Habibu to give us a little intro on breast cancer. Shall we, Dr. Habibu?
Breast cancer used to be known as disease of the Western or developed world. The second most common cause of female cancer in this part of the world, second to cervical cancer. However, in the 80s, breast cancer has overtaken cervical cancer as the most common cancer in Nigerian women. And worldwide, breast cancer has also overtaken lungs as the most common cancer in women. Breast cancer is more common in the urbanized area, and the higher incidence and prevalence of breast cancer in Nigeria is thought to be as a result of lifestyle change. We are becoming more urbanized, and because of that, the risk of breast cancer is also going up. However, in the developed countries, breast cancer is caught early because of screening. And the screening, when I say screening, I mean self-breast examination, clinical breast examination, mammography, and ultrasound scan of the breast. So they are caught early. So mortality is low relatively in the developed world. However, contrary to that, in our own setting, breast cancer patients mostly present late. And when they present late, there is high mortality. In Nigeria, 20%, about 20 to 30% of all female cancer is breast cancer. And of this, it gives us about 50% mortality of this number. And the breast cancer incidence is the peak of the incidence is between 50 and 60 years in Nigeria. However, in the developed world, it comes a decade later. So between 60 and 70, you see it. Since this is intro, I will stop here. Then I'll give the main lecture after the break.
We will quickly go on a very short break and we'll be back. And when we're back, we're going to take questions from the audience. Please don't go anywhere.
This is EN Radio, Nigeria's first Muslim radio.
Thank you very much for joining us. I'm Mohammed Saeed on the show Health Advocacy, and I have with me my two fantastic doctors, Dr. Hadiza Marliyya, and I have Dr. Muhammad Habibu. Thank you again for joining us. Some questions here from the audience, which I would like to read to you. Now, here, question number one: what are the different options for surgery? And before you answer that question, Dr. Habibu, I'd like to also inform that if you would like to contribute or ask any question, please kindly call us on 080-9640-5786. Again, 080-9640-5786. You can either send in a voice note through WhatsApp or you send a message through SMS. Dr. Habibu, the first question, I'm reading it again. What are the different options for surgery?
Now, since the question is to me, we are talking about skin cancer. Because if it is just ordinary burns, I believe Dr. Hadiza will be the one that will take it. So I'll be taking options, the type of surgeries that I will do if it is skin cancer. So for skin cancer, we will consider surgery. One, if it is getting to the bone, in which case we might be amputating it. If it is in the limbs and it's getting to the bone and it's the side where we can amputate, that is where operable will amputate it. That's complete amputation. However, if it is on the skin and it is large, we might consider to do removal of the ulcer, that's excision of the ulcer, and then a skin graft. That's we take a skin from another part of the body to cover it. Following that skin graft, the patient will still have both chemotherapy and radiotherapy. However, if the lesion is small, we could go straight and do radiotherapy and chemotherapy. And this also will be dependent on what we see following what we call staging. Staging the disease is a way or a method of trying to know in the real sense how far the disease has spread. How extensive is this disease, which will require doing chest and abdominal scan, computer tomography scan, CT scan. We could also do the liver function test, the renal function test. We want to know also, apart from even if it is in the liver or it's other part of the body, are this part of the body still capable of withstanding chemotherapy? Are they still functioning well? So there's a series of tests we'll do. And initially, even before the surgery, before any of these things, we'll take a sample from that wound to confirm that it's cancerous, because we can have a chronic wound that is not cancerous. So we'll take a biopsy and check to see if it is cancerous. And if it is cancerous, that's when we'll do this type of surgery for the patient. Thank you.
Very much. I have another question for Dr. Hadiza. And the question is that electric or chemical burns. I'm sure you've answered this before.
Yeah, so chemical burns can be in the form of liquids or, powdery, or sometimes even, block-like substances. They can all be, chemical agents can come in any of these forms. So really, it depends on the type of chemical agent that the skin is in contact with. But generally, if it's a powdery substance, you try as much as possible to dust off that powdery substance from your body before applying any form of water, to that part of the body. If it's a chemical substance, it's better for the person to be aware of what type of chemical substance it is that has, been in contact with that skin, because sometimes some chemical agents actually react with water if water is poured on that part of the body. So if viewers are interested, I could give another lecture on chemical burns specifically, on the types of chemical burns and how to manage each of them individually. But generally, dust off any powdery substance. Generally, yes, water to wash it off. Take note that there are some chemical substances that can react with water and therefore ignite an exothermic reaction, which produces a lot of heat and burn us. Hope I answered that question.
Yes, thank you very much, Dr. Hadiza. So I want to know, Dr. Muhammad Habibu talked about skin grafting. So in terms of burn injuries, I want to know if it's effective or applicable to all forms of burn injuries.
Well, skin grafting is one surgical option for managing burn injuries. There are burn injuries that involve just the epidermis, that is just the top layer of the skin. Now, these kinds of burn injuries are injuries that we commonly sustain at home, domestic accidents, soup pouring on your hand while cooking, a child dipping, his or her finger into hot water, maybe just for a short time, And so in those kinds of injuries, commonly they're mainly superficial. We define them as superficial burn injuries. Now, these kinds of injuries can actually be managed at home, by just using the bland agents and, covering it with the clean dressing, and they usually heal over a week. However, if the burn injuries are much deeper, and we classify those kinds of injuries as being dermal injuries, either, let me not be too clinical anyway, but we classify them as dermal injuries. These patients may benefit from some form of skin grafting, where skin from another part of the body is taken to cover the area that has been injured. Yes, that can be done.
Okay, one more question. So in terms of skin grafting for dermal injuries, like you mentioned, in your experience, has it ever occurred that some people might not actually be eligible for skin grafting? Let's say they don't have so much flesh that could be removed from another part to another part.
The skin, the human body is, the skin covers a large surface area on our bodies. So it's rare to find, to be in situations where we don't have any form of skin at all to harvest.
Sorry to cut in. I guess she's talking about a high degree burn, like all over your body, like there's all from head to toe.
Oh yes, yes, of course, yes, yeah. Well, in those kinds of cases, it's a more complex surgical procedure we're going to do.
Okay.
Yes, because I think you're talking about probably full thickness burn injuries.
Yes.
They're known clinically as full thickness burn injuries. Those are injuries where, the fat, the muscle, sometimes even the tendons, the cartilage, the bone has been damaged. And yes, in some patients, it can involve up to like 60 to 80 to 90% of the body. Now, these are very severe injuries. And before you even start talking about what you're going to use to cover the wounds, we first of all have to talk about removing that dead flesh. You understand?
Okay.
Because it's not just the skin that's been damaged. So it's removing that dead tissue down to sometimes the bone before we even talk about what we're going to use to cover that body, to cover that surface area that has been damaged by that burn injury.
Okay, thank you very much. I have one funny question saved for you, Dr. Hadiza. But before I give you that question, I will go to Dr. Habibu. There's a question here from the audience. When should I begin screening for breast cancer? At what age?
Yes, if you are a female at puberty, you can do it yourself. You can do self-breast examination. That's when you've had breast. When your breast starts growing, you can start screening. However, by yourself, except you think there's an abnormality, then you can be seen by a clinician.
Yes, thank you, Dr. Habibu. So you mentioned that at puberty, you
Yes.
can do self-examination by yourself. So it is
Yes.
possible for females at puberty age to have breast cancer.
Okay, I'll repeat that. I said the incidence of breast cancer is very low, below the age of 40. However, in my own experience, I've treated a lady of 16 years, I've treated 18 years, I've treated many 22, 23 years. However, the peak age is between 50 to 60 in this part of the world. But we have so many people that are between 30 and 40. And I've seen a lady of 16 years with breast cancer. So even though the risk is low, that does not mean that you can't do it since it doesn't cost you anything. And if there's a family history of breast cancer, first degree relative, that's mother or sister, then you can have a lady can have it at an earlier age. So it becomes more important to do it at an earlier age. That's at puberty, start doing it if there's a strong family history of it. Yeah, breast cancer results from multifactorial factors. There are many factors that comes together to cause breast cancer. However, less than 20% of women with breast cancer have genetic factor like the BRCA gene, BRCA1, BRCA2, Lee-Fraumeni syndrome. It's less than 20% that has that germ-like BRCA gene. However, those who have it, they tend to present earlier, they tend to have a more aggressive disease, and the disease tend to be less sensitive to treatment. And the disease also carry greater morbidity and mortality because of the genetic involvement. So people that have family relatives with breast cancer can be screened to see if it is in the family. However, over 80% of breast cancer cases are not linked to any genetic factor.
All right, thank you so much, Dr. Habibu. So I have one more question. I read once that breast cancer is not only particular to females. So I want to know how true that is. Is it something that some males can also contract?
Oh, yes.
And adding to that, what is the self-screening method? How do you do the
For
self-screening?
males, right?
Okay, I'll answer the two questions. All the organs of the body can become cancerous. So the fact that the male also has a rudimentary breast means that that breast can also develop cancer. In actual fact, about 1% of every cancer is developed by a man. So if you have 100 patients, one with breast cancer, one of them is likely to be a man. I have seen several men with breast cancer in my practice. And
Wow.
the presentation is similar to that of the woman. The only difference is that because of the rudimentary breast, the male patient is likely to present slightly earlier because it's something that is easily noticeable. Then the second question, if I remember very well, I'm trying to remember the second question. Yes.
How do you do a self-examination in terms of male breast cancer?
It's the same for male and female. Even though we don't push it for male because breast cancer is rare in male. It's not a common disease in male, but it's the same way. What you do is for females, I would say it for females because men don't menstruate. For female the 10th day of your menstruation, the 10th day, that's when you start counting from the first day. Menses usually will stop between 3, 5 to 7 days. But you keep counting till the 10th day. You go in front of a mirror and disrobe. You remove the upper dress, remove the bra, and look at the breast on the mirror. Usually, they are almost symmetrical. One can be slightly bigger than the other, but it should have been like that all the while if it is. Usually, one will be slightly bigger than the other. Then, when you look at it, if there is no severe disproportionate size between the one and the other, and there is no difference in the skin of everything is normal, there is no lump bulging on any of the breast, there's no redness or dark pigmentation any part of the breast, then you use your right hand to touch the left one. You have an imaginary dissection of the breast into 4 quadrants. That's, you imagine that the breast is divided into 4. You know, when I say 4 now, putting a line up, down, then horizontal. So cut it into the upper, middle, upper, outer, lower, inner, lower, outer. You understand? So use your right hand to touch around the left breast. Then you make it to see if anything will come out from the nipple. We are looking for bloody discharge if possible. Then you do the same on, you're using the left hand for the right breast. When you do this, if you observe any pain, any discoloration, any node or swelling inside the breast, or any bloody discharge, then you need to see a clinician. That is self-breast examination. Then when you go to clinician and the clinician does the same examination for you, that is called clinical breast examination. If the clinician thinks that there's something there, or once in like 2 years, even if there's nothing there, you can do a breast ultrasound scan if you are less than 40 years of age. If you are less than 40 years of age, you do a breast ultrasound scan. However, if you are more than 40 years, you can do a mammogram. Ultrasound scan and mammogram, these are imaging investigation, where you can be able to see the inner structure of the breast. So you can see a lump in there if it is present. This is the process of self-breast examination. I will talk about the causative factor sooner, but I hope I've been able to express the breast self-examination.
You have. I just, before we go, I'd like to ask Dr. Hadiza, a TV show where a plastic surgeon, it was actually in a movie series, a plastic surgeon premiered the treating of burn skin with tilapia fish, the skin of a tilapia fish. Is this just a Hollywood stunt, or this is a real thing?
I think all of us had this forwarded video sent to our phones when it came out, I think. Yes, it was a video showing the use of fish skin to cover burnt skin. Well, let me just explain that. That fish skin was actually used as a form of temporary cover for that injured skin. Ultimately, the fish skin is meant to help protect the inner part of the body from infection, from heat loss, and from water loss, that's dehydration. And then it will help, it will enable the body to help regenerate that skin. So it was used as a form of a skin substitute, just to enable the healing process to occur, because ultimately we know that fish skin is not the same thing as human skin. And so eventually the body will reject that. So it is used as a form of a temporary cover, yes. It can be used as a form of temporary cover, but remember that it is sterile fish skin. It is skin that has been, prepared in a laboratory. It has been made sure that, all those things that can cause the body to react to that fish skin are removed, and it is free of germs. And so it is not likely to cause infection to that person. So yes, there are so many forms of skin substitutes that may be used as temporary cover for some form of burn injuries, not all forms of burn injuries.
All right. Thank you very much, my fantastic doctors. If you're just joining us, we've been speaking with Dr. Hadiza Marliyya Suleiman, burns and plastic and reconstructive surgeon, and the founder
Of the YouTube channel,
of the YouTube channel, the Medical Information. And she has also been a wonderful host here. Also on the show is Dr. Mohammed Abibu, a consultant and head of department radiotherapy, Lagos University Teaching Hospital. Yeah, it's been a wonderful time having.
Assalamu alaikum. Thank you very much for having us.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Can I add a little message?
Yes, go ahead, please.
Yes, assalamu alaikum. Just in addition to what I presented today on burns injuries, if anyone is interested, you can go to the Medical Information channel on YouTube. I actually have about, I think, 3 to 4 lectures on burn injuries. I have a lecture on electrical burn injuries. I have a lecture on first aid of thermal burn injuries. And I also have, I think, a lecture on burn injuries in the kitchen. And I plan to still, post some more videos on that because it's such an important topic, especially as the dry season is approaching.
That sounds fantastic. Wa alaikum assalam wa rahmatullahi wa barakatuh. Thank you very much, Dr. Hadiza. And thank you so much, Dr. Habibu, for your time. It's been a wonderful outing today. All right. Thank you very much. Same time next week. Please join us. Bye-bye.
This is EN Radio. Nigeria's first Muslim radio.